Today, on this episode of The Crossover, we will be discussing chronic traumatic encephalopathy, the truth, science, and evidence, with discoverer of CTE and professor of pathology at UC Davis, Dr. Bennet Omalu. Find out the facts behind contact sports related traumatic brain injury and the long term consequences for athletes. Much more on this episode of The Crossover. We have the opportunity today to speak with the world expert on chronic traumatic encephalopathy. This interview holds a lot of special meaning for me because I've been such a fan of Dr. Omalu's work. I've seen it from the very beginning. And as a football fan, obviously, I've seen the changes that it's made for the better in terms of contact sports, and we'll get into that. So again, thank you so much for being here with us. Dr. Omalu, as I said, is the first to discover, identify, and name chronic traumatic encephalopathy. He is currently chief medical examiner for San Joaquin County and professor of pathology at UC.
Can I stop here?
Yep, of course.
I'm no longer the chief medical examiner. I left 3 years ago. I formed the Bennet Omalu Pathology.
Okay.
And I'm the president and medical director, but I'm also a clinical professor at UC Davis.
Okay.
So I'm President Bennet Omalu Pathology, a clinical professor at UC Davis.
Wonderful to hear. Perfect. Dr. Omalu has testified twice before the U.S. Congress and provided hundreds of testimonies as an expert witness in federal courts and across the country. Dr. Omalu is a member of what looks like basically every pathological committee in the country. I'm not going to go through those just in the interest of time. Amazingly, Dr. Omalu has 8 degrees, including his MB, BS, and MD from the University of Nigeria, his MPH from the University of Pittsburgh, and his MBA from Carnegie Mellon. He has 6 board certifications, including anatomic pathology, clinical pathology, forensic pathology, neuropathology, medical management, and certified physician executive. Dr. Omalu has received 3 honorary doctorate degrees from 2 universities in the U.S., as well as the Royal College of Surgeons in Ireland. He's also received the Distinguished Service Award from the American Medical Association. Most people best know his work, which has been depicted in multiple areas of the media, including the Hollywood film Concussion, starring Will Smith, and several New York Times best-selling books, including The League of Denial and Concussion. And finally, he himself has published several books, including one, The Truth Doesn't Have a Side, and Brain Trauma and Contact Sports, What Parents Should Know Before Letting Their Kids Play. So, as I said, here to discuss a topic which is very near and dear to my heart. Thank you so much, Bennett, for joining us, and it's really an honor to speak to you today.
Thank you so much for having me.
So let's just start with the basics for people who are listening. What exactly is CTE?
Well, CTE, it's not a novel disease. We've always known right from the time of Hippocrates that blunt force trauma to the head damages the brain. In the early 1900s, we discovered that boxers suffered from a disease that was called dementia pugilistica. And until I did my work, it was limited to only boxers. So, but now with my work and the works of other people, all types of blunt force trauma can cause permanent brain damage. The symptoms may not manifest immediately. It's a neurodegenerative disease with accumulation of abnormal proteins in the brain, and it belongs to the neurodegenerative class of brain diseases.
Now, people will ask, like, what are the signs and symptoms of CTE? And we all know there can be subclinical issues. There can be full-blown depression, suicidal ideations. But what are the classic signs and symptoms of someone who suffers from CTE?
So from the families I've spoken to, the first thing many of them notice in their husbands and sons is a change in personality. Progressive, it begins in a very subtle manner, and then it progresses. They develop mood disorders, impulsivity, a spectrum that looks like bipolar. They are this minute they are very happy, next minute they are very sad. and then accompanied by cognitive impairment. One common symptom is impaired memory, loss of memory, and then poor executive functioning. Some of them that may have businesses, suddenly the business will go down. And then criminality, tendency to criminal behavior, irrational behavior, unnecessary risk taking. And then chronic alcoholism, increased risk of becoming a drug addict, abusing drugs. And then behavioral changes, like some of them become paranoid. Some of them become more religious. So it has a broad spectrum of symptomatology. Also, I don't know if you've heard of the chronic traumatic myeloencephalopathy that looks like Lou Gehrig's disease.
Mm-hmm.
So this is where CTE involves also the spinal cord. But instead of having the protein that accumulates in Lou Gehrig's disease, you now have tau, and it will manifest with motor symptoms. And in addition to this, too, they have somatic symptoms like headaches, body aches, and pain. And depression.
Now, everyone talks about CTE in the limelight being football-based, but is basically any contact sport athlete at risk for this?
Yes, everybody is at risk, right? Not just in and outside sports. There is no safe, violent blow to the human head. So in fact, in my practice in forensic pathology, we see CTE in people who've suffered traumatic brain injury following motor vehicle crashes, in women who've suffered chronic physical abuse. Another one in a child who had some neurological impairment and had a tendency to be banging his head on the wall. So as long as there is violent impacts to the brain, the single most significant factor in the etiology of CTE is blunt force trauma. So blunt force trauma, the more severe, the greater the likelihood, and also repetitive trauma. But when you read the literature, some doctors and researchers state wrongfully that CTE is only caused by repetitive trauma. That is not true. That is not true. If you have, for example, a gunshot wound of your head, or you suffer a violent impact, maybe you fall at home, usually moderate to severe traumatic brain injury, you would have post-traumatic encephalopathy with the damage. But as the years go by, in some people, the brain becomes neurodegenerative, begins to accumulate proteins just like CTE. But I must emphasize the mistake we've made in the media. CTE is not the only disease you suffer after exposure to traumatic brain injury. It's just one of many. The diseases that follow traumatic brain injury, in 1969, the Neurological Association, I think the American Association of Neurosurgeons, I don't know what they were called then, had this syntax meeting, and they described traumatic encephalopathy as all the diseases that follow physical damage of the brain after blunt force trauma. So today I refer to it as the traumatic encephalopathy syndrome. And it starts from the post-concussion syndrome to post-traumatic encephalopathy, to even post-traumatic epilepsy, then CTE, then dementia. And also, people may not know, but epidemiologically, exposure to traumatic brain injury increases your risk of developing chronic cerebrovascular disease.
It's interesting, and I really want to focus on the first thing you said. So every single blow to the head has the potential to cause CTE and to cause permanent brain damage. It's not repetitive. I mean, repetitive obviously makes it worse, but every single blow to the head individually by itself causes brain damage.
I would qualify that as violent blows, because if I hit myself now, there's no almost no kinetic energy transfer to the brain. But violent blows have the risk of causing permanent brain damage. Now, there is no threshold, meaning somebody may suffer one severe traumatic brain injury and develop post-traumatic encephalopathy and CTE. Somebody may suffer the same trauma and may not develop it. So there is no certified or specified threshold that would determine if you suffer CTE or not. And so, like I have said in all my books, there should not be any intentional violent blows to the head.
That's a good kind of premise to live by. What about like that period of recovery when someone has a concussion and they wait several weeks before they're cleared to return to play or to any type of activity? Does the brain heal during that recovery period? Does that prevent more permanent damage? Do you believe in a timetable between the two, double insult that they call it?
I don't. Let me give you an analogy. You know, a concussion is like microscopic fractures of the cytoskeleton of the brain cell. And I remind people it's similar to a fracture of your skeleton, maybe of your femur. When you fracture your femur, I think you're kept out for, 3 months. Okay, roughly. I'm not an orthopedic surgeon, but I believe about 3 months.
Mm-hmm.
The brain is a post-mitotic organ that does not have any reasonable capacity to regenerate itself. The skeleton does. So which is more severe? Skeletal fractures of the brain or skeletal fractures of the femur? So you keep somebody out for a couple of months if he fractures his femur, but you keep him out for a couple of weeks if he fractures the cytoskeleton of the brain cells. Yeah. And in my own personal experience, I have examined brains of people who died 6 months after trauma, after a documented concussion. And guess what? You see changes in their brains at 6 months. And I've said it, but the leagues are not happy with me when I say this. There is nothing mild about a concussion. And if a player suffers a documented severe concussion, he shouldn't play for the entire season, for the entire year, because we're dealing with human lives here. You know, but it's not popular. I'm not popular, but I have to speak my truth clearly and quietly.
100%. Let's talk about diagnosing CTE. So currently, I know this is a big area of your research. Currently, we are limited to autopsies and these pathological specimens. I know you're doing a lot of research. Are there any ways to diagnose CTE in the living?
Yes, again, another misappropriation of the science in the media. As we speak today, CTE is being diagnosed by clinicians across the world based on a history of exposure and based on a progressive development of symptoms. So you could make a clinical diagnosis of post-traumatic encephalopathy, traumatic encephalopathy syndrome, CTE, clinically, but presumptively, which is the same as other dementias. When somebody has Alzheimer's disease, you make a presumptive diagnosis of Alzheimer's disease, meaning with a reasonable degree of medical certainty, you believe this person is suffering from Alzheimer's disease. Same applies to CTE. But when the individual dies, we now perform a definitive diagnosis, 100% sure. But as you know, in medical practice, you don't need 100% certainty. And all you need is reasonable degree of medical certainty. And sometimes, well, some people say it's more than 50%. So yes, you can make a diagnosis of CTE presumptively based on your symptom development. Recently, a group is putting together diagnostic criteria for the diagnosis of traumatic encephalopathy syndrome, but I strongly disagree with them. I actually sent a letter that they equated traumatic encephalopathy syndrome to CTE, which is not true. Yeah. Traumatic encephalopathy syndrome is much bigger than CTE, and it's not CTE.
Now, tell us a little bit. I was reading, are you still researching FDDNP as a way to diagnose CTE in the living? There was a marker that I was reading about that potentially could be used as a diagnostic tool other than just clinical examination and history.
Yes, so FDDNP was discovered at the UCLA about 30 years ago. And then when CTE came about, the professors who discovered it came to us, we merged together and actually ran some PET scans using FDDNP in football players and military veterans. And it was showing a very promising diagnostic utility. In fact, we applied for a stage 3 clinical trial, but we hit a roadblock. We needed about $12 million. We've not found anybody to finance it.
That's a big roadblock. I would say that's an enormous roadblock.
So you need to be pragmatic. You do your best, and it is what it is.
Well, so I guess the next question is, if you're able to diagnose this syndrome, this diagnosis in a living person, are there currently any treatments? Are there any treatments in the pipeline? Is it just avoiding head trauma? But if a doctor makes this diagnosis, what can the patient do besides just avoiding head trauma?
Well, there is no definitive curative treatment for CTE. It's a permanent progressive disease. What doctors do is to do symptomatic relief. They treat the symptoms as they emerge. So the best treatment really is prevention. But I believe there are some drugs now in the works that are being developed to impede the formation of tau and also to impede the chronic inflammation that accompanies the tau development. Where by the time your brain begins to accumulate tau or other proteinopathies, it's too late. It's too late. So I think we should be able to capture this disease at a very early stage and, if possible, treat prophylactically. But the FDA has not approved any drug yet, but as we speak, I know there's research going on many drugs.
Now, you initially discovered CTE in the early 2000s, so it's been a little bit less than 20 years. How do you feel like we have done as a medical community in terms of researching, raising awareness, coming up with new diagnostic techniques or new treatments? It's been about 20 years, and we all know medicine can move slowly sometimes. But in your opinion, as the person who first identified this, do you think we've done a reasonable job?
I don't think so. And in fact, I was discussing this with your fellow. You know, medicine is highly regulated, and free thinking is not encouraged. Thinking outside the box is not encouraged. Why don't we have an Elon Musk in the medical industry? Why don't we have Jeff Bezos in the medical industry? Why? Because it's strongly, rigidly regulated, monitored, traditional. And so have we done well? No, I don't think so. It's 20 years now. Why don't we have a drug treatment for it? Even Alzheimer's disease, we don't have a drug treatment for it. And you go to research institutes, research programs, you'll see many times it's headed by a much senior faculty who may be in his 60s or 70s, who has done something all his life and is fixated in certain ways. And if you come as a young professional, you come up with an idea, guess what happens? It's squashed.
Yeah, that's exactly right.
It's squashed. So am I happy with where we are? No, but again, CTE is very political because of the impact on sports. In fact, the Sports Illustrated last year, 2 years ago, said that Bennet Omalu is the single most important factor in the factor on football beginning in 2000.
Yeah, for sure.
Why do you say something like that? You know, it's very political. There's some corruption because money is involved. So we've also been competing with other alternative interests, sometimes conflicting interests that are very powerful. And at the beginning, they wanted to control the narrative, which what helped me was that I was not staff in any university. I was by myself. So I had the freedom and liberty to say whatever I wanted.
Absolutely.
If I had been working in a university, I would have been prevented from speaking my mind, and they could have taken the narrative and controlled it. Why? Because billions of dollars are involved.
Speaking of the billions of dollars, everyone knows the effect of your work on the NFL for the better, all the new safety protocols as much as they can. How invested is the NFL in CTE research? Are they donating towards research? Are they is there skin in the game when it comes to the NFL and CTE research?
You want me to be honest with you?
Of course.
The NFL is a corporation. And what do corporations do? To generate revenues and make money, make profits.
Yep.
The NFL is not in business to treat any disease. They're not in business to research any disease. So I never expected the NFL to do anything significant about CTE. Most things they've done is all about their business strategy, enhancing their business. And like I have said in my books, let us stop making this about the NFL. The NFL is a legitimate and valid corporation, just like Google, Alphabet, name it, Chase. They have the right to exist. They have the right to sell a product. They have the right to make as much money as they can. But the consumers, the players, the parents should know that if your son plays football, ice hockey, mixed martial arts, wrestling, boxing, of course, and ice hockey, when they play these high impact, high contact sports, in every play, in every game, you're damaging your son's or daughter's brain. And if you're an adult, in every game you play, you're damaging your brain. It has nothing to do with the NFL. The NFL does not point a gun on your head and compel you to play football. Many people call me. In fact, yesterday I got a call from Canada. Some guy, Dr. Omalu, help me. I'm like, help you? Oh, I think I have CTE. Why do you think you have CTE? I played ice hockey for 12 years. Okay, and after that, I played football. And I had to be honest with him. I said, sir, there's nothing I can do for you. It's permanent damage. But go to your university hospital and see what they can do to manage you. Okay, so people need to know the consequences of these games, and you make the informed decision for yourself and by yourself. And that is why it has always been my position that children should not play the high impact, high contact sports because they're not yet adults. Okay, they're not yet adults. So why would a parent make a child or compel a child to damage his or her brain for some transient excitement?
So along those lines, so I want to ask you a question because you're talking about informed populations, people to know the risks that they're getting into, and then they make their own decisions, right? Because they're adults. Do you feel like, again, we've made enough progress in the last 20 years raising awareness about this condition? 20 years ago, the word CTE didn't exist. It's 20 years later. Do you feel like we have done a good enough job educating parents, educating the public? And if not, how can we do a better job?
I think reasonably we've done some reasonable work. You're right, everybody knows CTE. In fact, I was in Europe once, in Hungary, Pech. They have a medical school there. So in the evening, I was at my hotel room with security, and they said, hey, let's go watch soccer. And then there we are, there was a commotion, and I asked my security, what is going on? He said, oh, you can't believe what they are saying. I said, what? In their language, he said that they are saying, hey, take him out of play. He suffered a concussion. Have you not heard of this disease the Americans are talking about?
That's great. That's great. No,
so reasonably, we've done a good job to educate populations. But one thing I'm observing is See, among some research groups, there is this competition, or there's this urge of ownership that undermines the science. People are very exclusive. They don't want to open it up, invite everybody to develop the science. And people are writing papers that honestly are misappropriating generally accepted principles of science because they want to be noticed, they want to make noise. We need to stop that. It is not about ourselves as doctors, but about that common shared humanity of all of us. If you notice, when I started this work, nobody knew who I was. I wasn't doing it for myself. I was doing it for the sake of the truth. Because I discovered the NFL knew about this disease and did not want people to know about it. It's also, I think we need to recognize that, not seek the limelight, and focus on the science, not for your own aggrandizement, but for the good of society.
Now, you said, just going back to children playing sports, contact sports, that children below 18 should not be allowed to play contact sports because just like drinking or smoking, they're not old enough to make their own decisions. But also physiologically, is the developing brain more at risk for long-term consequences after head trauma than a fully developed adult brain? Are kids, other than just not being educated or not being knowledgeable, are they also more at risk just based on their age?
Well, it's not yet been confirmed through research that children are more vulnerable. But just my own personal observation, you see, if you're building a skyscraper and you are at the foundation level, if something affects the construction of the foundation, the building is not going to be solid. So children, as their brains are developing, when their brain is damaged, their brains are not going to be solid when they become adults. Their brains wouldn't attain the level it should have attained if they had not been exposed to repetitive traumatic brain injury. And a good example I gave, I actually have a friend of mine whose son was an A+ student. He got admitted at a very young age into a medical school. In high school, he played football for 2 years. And after playing football, he now went back to medical school and he couldn't perform. His grades dropped to C. He ended up dropping out of medical school. And so somebody could be at an A+, or somebody could have been at an A+ functioning level, and then he exposes himself or herself to repetitive traumatic brain injury. Then when that person becomes an adult, is functioning at a C+ level, but nobody would know.
Yep.
Nobody will make that connection. And in fact, one of my employees a couple of years ago was having these very severe bouts of headaches. And doctors were diagnosing migraines. So she came to me someday. Said, Dr. Omalu, I need your help. You're a brain doctor, right? And the question I asked her was, have you been exposed to traumatic brain injury? Have you suffered traumatic brain injury? She said, yeah, when I was 5 years old. I said, what happened? That she fell from a tree and was unconscious for about 5 days at the hospital. I said, okay, go do an MRI. And guess what? Once she did the MRI, there were changes in her brain that were post-traumatic.
So even that far down the road, I mean, there's never enough of a period for you to recover, which is what you were saying earlier. Once the damage is done, the effects are years later, and there's no amount of time that's going to allow the brain to heal appropriately.
Yes. In fact, in 1970, the Royal Colleges of Physicians of London published a position paper from their study of boxers. And I think the lead investigator was Dr. Roberts. And they discovered that following traumatic brain injury, that symptoms of CTE may begin to appear up to 40 years later.
Wow. It just goes to show you kind of, there's no recovering, there's no undoing the damage, which is why that decision to play sports is so critical. Have you in your group, or have any groups, found a genetic predisposition? Are there any race, gender, genetic predispositions that make people more at risk to get CTE?
Well, I don't think the science has gone that far yet. It has not been confirmed that there is a specific genetic predisposition. But many of these diseases, including CTE, are multifactorial in terms of etiology. Just like hypertension, what causes hypertension? We don't know, but there are risk factors for hypertension. So there are risk factors for CTE. Are there any confirmed genetic predispositions? Not yet.
Not yet. Going back to the NFL, because it's really fascinating in terms of how that dynamic works. They've seemed to institute new protocols, better helmets. Players get sat out. There's more recognition. There's more physicians examining them. What else, in your opinion, other than just not allowing contact sports, what else can the NFL do, in your opinion, to make the game safer? Because they never say safe, they say safer, which
Yeah,
I know is a
thank you
big thing that you say, because football can never be safe based on everything that you've just said before and everything that your science has proven. But if you were running the NFL, what could you do to make the game safer?
I could just come out and be straight with society and tell the truth. Every year before the season starts, both at the high school, college levels, the players should have about 2 hours of lectures, educating them on the dangers of playing football. Players need to know.
Yep.
Since you cannot make it safe, there is an inherent risk and danger in playing football. The NFL should stop denying it. Okay, it's a very violent sport. They'll be very straight with society, educate the players, so that, assuming a player really wants to play football, and he knows, look, there is a high risk of damaging my brain, he may say, okay, you know what, I'll play only for 1 year. But some of these players don't want to accept the risk, are in denial until it's too late. And by then, there's no NFL to help them.
What would be interesting, so kind of like when you buy a pack of cigarettes, you can't buy a pack of cigarettes without having something right in your face that says this causes lung cancer.
Yeah.
You're saying basically you can't play in the NFL until you take a brain health course that basically, it could be an hour, it could be a 5-hour course, whatever, a course that basically documents that player understands the inherent risk to his brain. That's a very novel idea. If that was to be mandatory, how many players would have second thoughts? How many players would shorten their career? How many players would just retire altogether? I think it's a fascinating idea.
Yeah, it's yet to be seen. And I think at the beginning of every season, not just once, okay, they need to be educated, to be informed. Because moving forward, since the settlement with the retired players, the NFL is not going to pay you any money, because it's assumed that this game is inherently dangerous. Mm-hmm. So I think education, informed consent. I don't watch football. I try my best sometimes. Just the impact, boom. What passes through my mind is what is going on at the cellular level in those brains. A helmet doesn't protect you. But there are parents and players today who believe that a helmet protects you. And the more expensive the helmet is, the more likely that it will protect you. That is bogus. Parents need to know that. Players need to know that.
Yeah.
What the helmet does is it prevents a catastrophic injury. That's
Yeah.
all it does.
What would you say in terms of the prevalence of CTE? Because I've seen the literature varies in terms of numbers, and I know that you've done a lot of studies on this. In your opinion, what percentage of of NFL players who have retired after playing in the NFL have evidence of CTE? I know you've been quoted as saying 90+%. Is that correct?
I'm not even, in fact, why I said 90 plus is I just wanted to be polite. I believe personally that if you played football through the professional level, that you will have some form of brain damage with or without CTE.
Now,
I mean,
clinical versus subclinical.
both. Like Mike Webster. After his diagnosis, his wife now came to us and said, you know what? Looking back now, he began having symptoms while he played. So it's a combination, subclinical and clinical, and sometimes even clinical, but almost on a very subtle clinical manifestations. Okay, so if you play football, elementary school level, middle school, high school, college, NFL, by the time you're retiring, there is 100% likelihood that you've had some type, some degree of brain damage with or without CTE. A concussion is a type of brain damage.
Yeah.
A concussion is a type of brain damage.
So you can imagine someone who has dozens of concussions over the course of his life.
Well, Mike Webster, it was estimated, had hundreds of concussions over his, I don't know, he played for 17 years.
Mm-hmm.
Yeah. So this is not really a laughing matter. It's something that should be taken very seriously. And one other social perspective is, I think when you go to see a football game, you'll notice that majority of the players, over 75%, are Black men. Meanwhile, Black men make up only about 6% of the population. Blacks make up about 10 to 12, then half of that, 5 to 6%. So why would a group of people that make up only 5% of society make up 75% of football players? And you go to some of these African-American neighborhoods and towns, right from childhood, it's impounded on them that football is your life saving. Football, you must play football. That if you want to be a tough guy, you must play football. Why? I think it's a civil rights issue of our time. Why are Black men intentionally damaging their brains to entertain other people?
Such an ethical dilemma. I mean, there's so many aspects to that argument that it's an incredible question. I don't even know where to begin with that. But I mean, wrapping up, just because I know you're so busy, Dr. Omalu, in your opinion, if you could make the final decision, should all contact sports be banned, or is it simply make sure whoever decides to play that sport is educated on the long-term consequences?
My position has always been, let me draw the analogy of alcohol. We know alcohol is inherently harmful, cigarette smoking. So what do? We let you reach the age of consent to make the decision for yourself, whether you smoke or not, whether you drink or not. So why is football different? Football is inherently dangerous. High impact, high contact. Remember, I'm saying high impact, high contact sports, okay? So if a child has not reached the age of consent to understand the risk he or she is taking, why make him play? If you go to the Olympic Committee website, International Olympic Committee, there are tens, if not hundreds of sports children can engage in that are not high impact, high contact. Okay, then you wait, like we've done with every other thing in our lives, until you become an adult. You play. Okay, until you become an adult, you play. That has always been my position. I don't believe anything should be banned. We've not banned skydiving. We've not banned deep sea diving. But as long as you're an adult, you have the freedom, liberty, and right to do whatever you want to do, as long as you don't compromise someone else's life. And I will fight to die for that right and freedom and liberty, but not for children. I'll also die to protect children. But it's not a popular opinion, though.
I mean, I think that opinion is definitely gaining popularity because it just, like you said, there's so many aspects of our lives that carry inherent risk, and we're allowed to make that decision once we're an adult. As a child, as a young adolescent, you don't have the knowledge base to make an informed decision. So I think your view is definitely gaining traction, and it obviously makes sense just from common sense. Listen, Dr. Omalu, thank you so much for your time. This is obviously a very special interview for me, having followed your work, seen the impact that you've had. Congrats on really changing the way we view contact sports. It's kind of crazy to think that 20 years ago, we literally thought it was okay to just get your head knocked in over and over and over again.
And smell salt.
Yeah, exactly. And then the moment they wake up, they go back into the game. But the fact that you discovered this incredibly prevalent condition, you have put the science behind it. It's impossible to kind of doubt the science. And then you've educated the rest of us, and you've really changed the lives of, I don't know how many people, how many hundreds of thousands of people playing these sports. Obviously, kudos to you and the rest of your team.
Thank you. Thank you. I hope you watched the movie Concussion.
You look just like Will Smith. Honestly, I thought you were Will Smith. You look the same.
Oh, no, come on. Give me a break. Did you like it?
I saw the movie and I was a big fan. And obviously it sheds light on all the amazing work you do.
Yeah.
All right. Well, and you say you're going to be here in Miami.
Yes, in December.
With you when you're here.
Yeah, I'll let you know. Maybe we'll go have a drink or something.
Absolutely. Look forward to it.
All
right, buddy. You have a great day. Thanks again.
You too. Bye-bye.
Take care.